Imagine waking up every day with a constant searing pain in your feet, making every step a challenge. This is a reality for many chronic nerve pain sufferers. Picture the simplest tasks like walking to the mailbox or standing to cook dinner, becoming monumental feats. The joy of a leisurely stroll is replaced by the dread of the pain that comes with each footfall. And this isn't occasional discomfort we're talking about, it's chronic, relentless pain that can significantly impact the quality of life. But it's not all doom and gloom. Science offers a glimmer of hope. Have you heard of angiogenesis? It's a natural process where new blood vessels form from pre-existing ones. This phenomenon is not just fascinating, it's potentially life-changing. It could hold the key to easing the daily struggle of chronic nerve pain and restoring foot function. But what if there was a ray of hope? A scientific process called angiogenesis that could play a key role in nerve cell regeneration? First, let's demystify this term, angiogenesis. It may sound complex, but it's a natural process our bodies undertake every day. At its core, angiogenesis is the creation of new blood vessels from pre-existing ones. Imagine a bustling city expanding its road network to handle more traffic. In much the same way, our bodies construct new blood vessels to transport vital nutrients and oxygen to areas that need them the most. But how does this happen? Well, when a part of our body is damaged or deprived of oxygen, it releases signals. These signals are like a distress call, prompting our body to respond. The response? Angiogenesis. The body starts to build new blood vessels, creating a network that can deliver the much-needed oxygen and nutrients. This process is crucial to healing and tissue regeneration. So, angiogenesis is our body's way of building highways for nutrients and oxygen, vital for healing. But how does this relate to nerve cells? Here's where it gets interesting. Angiogenesis doesn't just help in healing wounds, it also plays a crucial role in nerve cell regeneration. Now let's picture this process like a bustling city. The nerve cells are the city's inhabitants and the blood vessels are the roads that bring in supplies. Without well-paved roads, the city's inhabitants can't get what they need to survive and thrive. Similarly, nerve cells need blood vessels for their nourishment and growth. In the context of nerve regeneration, angiogenesis helps build these roads. It constructs new blood vessels, ensuring a steady supply of oxygen and nutrients to the nerve cells. This process not only supports the survival of existing nerve cells, but also encourages the growth of new ones. So, with angiogenesis laying down new pathways and bringing essential supplies, nerve cells can regenerate more efficiently. In simple terms, angiogenesis nourishes and supports the growth of new nerve cells. This brings us to the question, can it help in restoring foot function? Imagine a future where chronic nerve pain is not a lifelong sentence, but a condition that can be improved, thanks to angiogenesis. This incredible process where new blood vessels form from pre-existing ones can potentially restore foot function and significantly reduce chronic pain. Picture this. Instead of being limited by discomfort, you're able to take steps freely, without the shadow of pain looming over you. Exciting research is emerging in this field. Studies have shown promising results, with angiogenesis playing a pivotal role in nerve cell regeneration. Real-life stories from patients who've experienced the benefits of treatments related to angiogenesis are truly inspiring. They've seen improvements in mobility and reductions in pain, enhancing their overall quality of life. While more research is needed, the science of angiogenesis gives us hope for a future where chronic nerve pain can be managed more effectively and foot function can be restored.